Gates Foundation. Professor Bakari regularly leveraged his model to guide public health decisions. Notably, he acted as a technical consultant for the Nigeria Center for Disease Control under the World Bank-supported project, delivering data analysis for vulnerability risk assessment mapping, VRAM. He has also served as a virtual visiting lecturer at Duke University Global Health Institute, USA, and Moore University School of Public Health, Kenya. His prominent professional roles include co-chair, Measles Analytics Hub, Chairman, Regional Chair, African Society for Industrial and Applied Mathematics, 2024 till date, National President and Global Board Member, 2023 to 2025, for Applied Malaria Modeling Network, and is also the editor in International Journal of Mathematical Science and Optimization, University of Lagos. Professor Bakari also works as a modeling and analysis consultant with NGOs in Nigeria Limited and Solina Center for International Development and Research. He has organized more than 10 international national schools, workshops, and conferences in modeling and analytics free of charge, with participation from different parts of the globe. His center has recently attracted meaningful research collaboration with AIMS Cameroon and AIMS Rwanda, where 8 MSc students from AIMS Cameroon will be on ground for 4 to 6 months, conducting their research in Ikamda Foyer under his supervision, while the AIMS Rwanda student is already on ground conducting the research with Ikamda under his supervision. Please join me in welcoming Professor Emmanuel Afolabi Bakari to the podium.
Thank you very much. Good morning, everyone. I want to welcome every one of us. Standing on the protocol that was proposed on Monday till now, I don't want to stretch on protocols. I want to welcome every one of us this morning as I'll be giving my talk. Looking at the situation everywhere, all over the world, data is being collected, and there is need for us to do something with data from different platforms. And majorly, we are collecting data from malaria, infectious disease, and non-infectious disease. So it's been my interest to use mathematics beyond the academia, or to confront problems in the community and industry. Now, when you talk about modeling, you have 2 directions to modeling. You have the academic models, and then you have the operational models. The academic models, you sit down in your office, develop a conceptual model, you follow the normal routine. I don't have time to talk about it so much, where you find out that almost all the papers are the same positivity, boundedness, and all of that. Nobody is using that because they are not useful in the community. Now, our interest mainly is not just to do the academic model, but to do something that can guide policy, that can inform policymakers on how to go about decisions when it comes to interventions, immunization, and all of that. So I'll be looking at what we have been studying and working on for the past many years, from high body to high impact, optimizing sub-national intervention mixes for malaria pre-elimination in Nigeria's 2021 to 2025 strategic window. Now we find out that when it comes to malaria in Nigeria, a lot of people are doing many things, but they don't know what goes on in the public space. You cannot do modeling by separating yourself from epidemiologists, public health, and all of that. Now, you want to work on Lassa fever, you don't have any access to national strategic plan for Lassa fever, and you are working on Lassa fever in Nigeria, then you have not started. Now, currently, now you find out that Nigeria is on the sixth plan when it comes to malaria, and they have had many plans. I will be talking about that. But before I look into some of those things, I need to shed some light on what is modeling, what is mathematical modeling. Why do we need mathematical models? Now, mathematical models, they are tools that simplify real world situations. They are meant to simplify real world situation. Real world is very complex. And then maths come as a tool. Now it means that the question does not come from maths. The question comes from the real world. The question comes from the public health. The question comes from the question comes from the geology question, the physical question, the chemical body. Now, they help decision makers compare the likely impact of implementing a range of policy decisions on disease body and other outcomes across a population. So people are trying to know, why should we do this? And there is no way to know except using modeling and data to extrapolate. Now we are in 2026. I want to know what will happen in the next 10 years. The model can come to play because we are not yet in that year from 2027. Recently, I was called on by African CDC. You know, something is going on in Ebola. In Congo and DRC. They are working on Bundibogyo. That's a particular strain of Ebola that is going on and is very deadly. It's deadly because the rate at which people are dying is not like the normal Ebola that we have now. And then it's actually, as at yesterday, Uganda border will not collapse. So you find out that the world is turning to modeling. WHO, African CDC, talk about different WMO, meteorological organization. They want what modeling will come up with. So by simulating how disease spread and how various immunization approaches might perform under different scenarios, models can inform decisions on when should we do this, how should we do this, how should we deploy our vaccine, and to whom vaccine should be delivered. Now, all of these are orchestrated by modeling results. It's not just by sitting down at home and make decision that is not scientific and based on data. So we are in a generation that data are being collected from social media, from your WhatsApp, from your you think when you are using WhatsApp and you are pressing, people are collecting mobility data where you sleep last night. Yes, are collecting data where you use your phone last week. So when there is a disease spread, they know where you go, where you have been all around. So all those data are useful to give information on decision. Models are used to combine available data and other information, make explicit use of assumptions, and test various scenarios to estimate the likely impact of future decisions. People want to make decisions, but they need data. Now, any decision you are making, let me give an instance. Now, in your house, you know that you are sick. So every plan you want to make concerning any income that comes, you make it based on the data, the number of people in the house in a month. So if you know that your salary is 50,000 naira, and you know you are sick in the house, you plan within that. So where there is no data, there cannot be correct plan for any population. So policies are being made based on data, given the model. So we need to, people need to know that because we are in the world of data. Everybody is collecting data. And why the data is collected, there is need for prediction, there is need for forecasting. Now, although models do not replace local evidence, they can bridge gaps in settings where such data are unavailable or incomplete. So it means that modeling, when you are dealing with models, you don't separate models from what is going on in the community. Now, if I'm to develop a model, the first interest is to look at the data because I'm looking at the population. Now, I cannot say that I have developed a measles model and then I don't have any data. I'm now using the model to advise people. You didn't use data. So there is a disjointed, that one is a theoretical work. So doing a theoretical work is different from managing your model with data. Data that has to do with a particular population. And then you need to do what we call extrapolation and prediction. So ultimately, modeling results should be interpreted in combination with other sources of reliable evidence, operational realities, and ethical considerations. Now, like what he was saying, the professor Oye-Ekiti that spoke on Tuesday was talking about, because modeling now has gone beyond, you don't sit down and write one equation inside paper and then you are plotting something that does not exist when you don't use it with data. Now, modeling has gone beyond that. Now, modeling has come to a point. Now, recently, I had some students from AEP that are doing modeling with us. The master students, there's a collaboration within AEP and the center. And then some of them had parasitology background. So we needed to collect primary data of some particular place in Oye-Ekiti State. And then using the data to now predict some information and make some decisions, and using model to confront the data, determine what will happen, or either retrospectively what has happened, or prospectively what is going to happen in the Oye-Ekiti State. So there is a kind of collaboration that is being done now, that we find out that modeling is not just what you do by mathematician alone. You sit down in the office, you develop everything, and it does not speak to any population. So now mathematical models help decision makers choose strategies that can, for example, save lives or use resources more efficiently by showing what might happen if certain conditions are made in health programs. So, and then we found out that the modeling process is an iterative set of steps that contains problem formulation, including defining modeling question. There are two different modeling questions you can develop. Now, and the question does not come from mathematics. The question comes from either the epidemiology of the disease or the biology, the pathogenesis of the disease that you are looking at. Now, the question does not come from math. The question comes from the biology, the epidemiology of the disease, but the method comes from mathematics. Now, you can develop a research question that is based on carrying out a research. Now, you can carry out a research that has to do with modeling study, and you publish the work. And then you can also do what we call policy-driven model. That is, you collect questions from or NCDC, like all the students we have in the CAMDA, the questions they are working on is from Nigerian Malaria Elimination Program. Model something, and we got those questions, and it forms the PhD work, and then there is feedback every month with them. This is what we are doing, this is the result, and that's why they made the CAMDA a national modeling consultant. The CAMDA FOIE has been recognized as national modeling consultant for malaria in Nigeria since 2 years ago. Now, we model their problem by confronting their questions with their own data on NMDR, that's National Malaria Data Repository. Now, model development involves problem formulation, data contextualization. Now, if your model is going to be useful for anybody, then it must be confronted with data and also the problem of the industry. Now, what we have seen in our current day is that the academia is playing a parallel game, the industry is playing a parallel game. So there is no correlation, there is no combination. So you find out that what we are doing at the end of the day, when the student finish, the student cannot, most of the students we are training, they cannot fit into the industry because there is a parallel line between the industry and the academics. Now, what CAMDA has come to bridge is that we are now aligning what we do, because currently we work with industry, we solve problems with industry, we get jobs from industry, we deliver and solve problems using modeling to confront their data. And then, so you cannot there to advise anybody when you did not use a particular population. You can't. Then model development. Model development includes fitting and model validation. Now, so, and then you have scenario formulation and results. Now, when you talk about scenario formulation, it can be two perspectives. You can do a scenario formulation based on retrospectively, and then you can do scenario formulation prospectively to look at what might happen in the nearest future. Now, problem formulation, these are some of the steps, problem formulation. Now, under problem formulation, we have definition of the model question. Then the next is data conceptualization. You can't do models that is operational that can actually help the community without data. Now, what kind of data? And we are going to look at that. Model development, fitting and validation. Model development and parameter estimation. That's what it involves. Model validation. Model validation is after you have developed your model, you have fit it to data, you get some out of sample data, and then you do the same thing you did with the first fitting, you do it with the out of sample data to be able to confirm whether your model is useful. So, and then you go on to, before you can do prediction, you must carry out what we call model validation. Now, and then scenario formulation and result interpretation. Scenario analysis, interpretation of evaluation of result. Now, when it comes to Nigeria, we are actually far behind most countries. I may not have time to show you some results from UK, from US, people have been using modeling for many things for several years. They have used it to make decisions, but we didn't start on time in Nigeria. Now, there are 6 main steps in modeling process that I've mentioned earlier. Now, let me quickly rush and move to, now, when it comes to the question, now, what do you ask yourself? What is the decision or policy question of interest? What are the decision question or policy question of interest? Now, when you want to do modeling and you don't have a question, then there's no beginning, there's no direction. Now, the question does not come from mathematics. The question comes from the biology of the disease. Then, can it be addressed through modeling? Is it every question that can be addressed through modeling? Now, if it can be addressed through modeling, what kind of model do you use? Now, sometimes it may not be a mathematical model. It may be a statistical model. It may be a machine learning model. They are different. They are not the same. Mathematical models are based on mechanistic. They are mechanistic models, and they actually focus on transmission dynamics. Now, when it comes to statistical model, they are surface-based models because they are focused on correlation analysis and looking at the behavior of the patterns. But when it comes to machine learning models, they are black box models. They are black box models because you cannot touch them. They are already there. The algorithm are built. You just need to put. But one difference between machine learning model and statistical model is machine learning model can handle large number of data, much more than statistical model. And then, now, the lag behind machine learning model, I'll be talking about it as a roundup because the machine learning models are black box. You can't do anything to them. But you can actually cover their disadvantages using machine learning plus mechanistic model. We are developing a scheme like that in our center in the recent time. We are looking at how do we match machine learning models, mechanistic models, to be able to fill up the gap. And then that one is going to provide us what we call gray box model. Gray box model. Now, what modeling question does the study try to address? Does it match the policy question? Now, I need to move fast so that I don't take much time. Now, so then when it comes to data conceptualization, what data were used? You need to ask. What data were used? What kind of data do you need? Are they representative of the population of interest? Now, you said that you are working on Ekiti State. and you don't have data on Ekiti State, how will your model inform what is going on in Ekiti State? Say you are working on Nigeria, you don't have data on Nigeria. How will your model inform what's going on in Nigeria? So where did the gap? Where did the data come from? Where did you get the data? What's the source of the data? These are questions you must ask. And then how were the gaps addressed? How were the gaps addressed? Was a quality assessment conducted? These are things you must look at. Now, next comes gathering and understanding of the data and epidemiological landscape. Now, including their underlying biology. These steps involve identifying what information is available, recognizing gaps or limitations, and finding alternative solutions, such as using data from similar settings. So models are only good as the data rely on. So a good model must be parameterizable. If you say you have developed a model, can we test it with the data whether that model is useful? Can we validate your model with the data? If you cannot, then what are you doing? So because we'll just be repeating the same process. So we must be able to do that. So whether after defining a model for the modeling exercise, the next step is to create a list of data necessary to answer the question of interest. You need to know, identify what kind of data do I need to respond to what I want to do. And then this data may include information on vaccine coverage, historic cases and outbreaks, the immunity or susceptible profile within the population, and other demographic considerations. These data come primarily from national database, but they may also be reported in the WHO immunization dashboard and disease surveillance databases. Now, these are some of the following list of data sources commonly used in model